Yes.
Hi, it's Kay.
Hi, Kay.
So, what that bill was from, it was actually from the emergency room physician. So they bill out of another completely different thing than SSM does.
Okay.
So I called them. I was on hold for 30 minutes, but I was not giving up.
I appreciate that.
I got through to them. I gave them all of your Medicaid information.
Mm-hmm.
They are going to they're going to file that bill with Medicaid. And just so you can note somewhere on that bill, I spoke with Penny.
Okay.
And her last initial is L.
Penny L. Okay.
And I did it today, if you want to note that. And she told me that she would get that bill sent out immediately to your insurance company.
That's the thing, is Medicaid's already confirmed they've paid it.
Right. Well, they haven't paid this one. Now, they paid the hospital.
Okay.
So they're going to pay a hospital bill. So what happens and what is so confusing with everything that the emergency room does, so the provider you see, he's actually a contracted provider and he bills out of a completely different state. So this Team Health is his billing for his services that he provided you. You're going to get a bill from the hospital for actually using their bed, laying in their bed, using their stuff. So it's so confusing. So what happens is the ER doctor bills his part, but he's billed out of a completely different state with a completely different name, which is very confusing.
Right.
And then you're going to get a bill from the SSM or the St. Anthony's Hospital for actually using their facility.
Okay.
So this team health is actually for Dr. Fitzgerald that you actually saw in the ER that day. So this is his bill, and then Medicaid would have actually paid that bill for the ER visit that was for SSM for using their actual facility.
I appreciate you trying to explain it. It's confusing to me.
Yeah, it's super confusing because you're like, okay, I was in only one building, but now I'm getting two bills.
Well,
But it's because that doctor bills out separately for his services.
Okay. I'm sorry. I'm at a loss here because I get what you're saying. I fully get what you're saying. You're saying one's a hospital bill, one's a doctor's bill.
Yes.
And they come from two different, but they come from two separate. Like one doesn't say it comes from the doctor. They both say they come from the hospital.
Right. So what happens is you're going to get that bill that says Team Health, whatever it says. And then somewhere it says SSM. Let me see if I can get it pulled back up here.
Okay.
So it says your visit to St. Anthony Shawnee Hospital, and then it gives you your July 4th, your Dr. Fitzgerald Emergency Room Department.
Yes, ma'am.
And then it says Tide Physician Services.
Yes,
but what they don't tell you is it's going to bill out from some place called Team Health. Emergency Physicians of Mid-America PC out of Cincinnati, Ohio.
Oh, okay.
So it's actually for Dr. Fitzgerald's charges for actually seeing you in the hospital or seeing you in the emergency room. So it makes it very confusing.
Okay. Yeah, I mean, I'm just kind of. How do we clear this up?
So hopefully it's cleared up. So I gave them all of your Medicaid information. So I gave them your Medicare ID number, told them it was effective on 7/1, and they're going to get that filed. So they're going to file that Dr. Fitzgerald's bill out to Medicaid.
Okay.
So if you get another bill from them, I don't know when they bill this one out, but
I can tell you it was billed out on this bill ID. Bill date was August 16th.
Okay, so hopefully Medicaid will have paid by September 16th. If you get another bill after this billing cycle, please call me because I'm going to keep all my notes on this. I'm going to keep it where I have a file of everything, who I talked to, and what we said.
Yeah, no, I appreciate that. You're gonna find it's a long, lengthy process. Trust me, just from I mean, you know how far I've come on my end, so you know how long I've been pushing this thing.
Yes, absolutely, and
So
it gets so confusing for patients. It absolutely does because of the different billing things you get. You'll get one from like some radiology place or some MRI place or
right,
some, and you're like, well, what's happening here? I was only in one place and I'm getting like 10 bills.
right.
And it's just that everybody bills out so separately, and it would be nice if they would kind of like give you a handout that says if you were in our emergency room and you did any of these types of services, you will get a bill from, so that they're not thinking, oh, well, I already got a bill from the hospital, but now I'm getting another bill that says it's from the hospital, and a lot of the times they feel like oh, they're double billing me, and
Well,
when
the Centauri
actuality
thing,
they're splitting all this up.
Right, no, I understand that, but like the Centauri part has already been paid, and now this Health Solutions, Team Health, Team Health.
Team Health, yes, sir.
Okay, and all that. How do I get what information they were given and all that? Because, I mean, this is ongoing since the 4th of July,
Right.
and
So
I've met with Randy Cam on this deal, and
right. So the Team Health is actually it's not different, and I don't know if Steve how to
Okay,
explain.
no, my question is how do we get documentation of where all it went, so that I can follow it back later for documentation? How do I get all this on documentation, so that I can trace where all it went?
So here's what I would suggest: is you keep these bills, and then write down. I mean, I talked to Penny today.
Mm-hmm.
I gave her because they showed you as a self-pay patient. So they didn't have your Medicaid information for Dr. Fitzgerald's billing office out of Cincinnati, Ohio.
Right, which Randy had already addressed.
Okay, so I don't think that they got any that they got any of your health information, because the only thing he gave them was data service, the level of service, and the billing charge. So as far as medical records and knowing anything about your medical records, this billing company did not get that.
Okay. Okay. Is there any way to show the disclosure agreement or anything? Because, like I said, this thing, I put in the request for it in July whenever I met with Randy, and I believe the statutory date to have the information to me is up, and I'm.
So there is a view billing rights. So on your bill, there is a little thing that says view billing rights at, and I don't know if you have a computer, but there is on that one bill, let me see which bill this is. So it's the one at the top says your visit to St. Anthony Shawnee Hospital. So I guess it was maybe the last one you got. Down below it says view billing rights.
Yeah.
And then it gives you
a portal that you have to sign in through a third company.
Well, it just says pay.teamhealth.com
right.
/rights. So I don't know if that will help you.
Okay. I mean, I understand. I appreciate you trying to reach out on this particular bill. I'm trying to fix the overall issue. That's my goal for today. And this just shows it's the Centauri thing happening again. I mean, it's the Centauri thing, just with a different company. I'm still trying to ask for the documentation where it was this close.
Have you gotten any, like, your medical records or anything from the hospital?
I went in and asked for it. I went in and asked for them, and I've gotten some. But what I want, the thing is, I'm considered. It says on the paperwork that I'm. What is the exact verbiage? Uncooperative. Uncooperative. I wish to challenge that HIPAA information, as I believe is my right. I wish to challenge that status update. And so I went to the hospital to challenge that. I was shipped around to the wrong people for 5.5 hours. Mr. Cam's aware of this situation. I'm looking to resolve that situation. I get this bill in the continuation of this process. I go to the hospital to address it, and instead of meeting with anybody from the hospital, I'm met with security who calls the cops on me, who has me.
So they wouldn't talk to you about this bill?
No, ma'am.
This Team Health bill?
No, ma'am. I was not allowed to talk to anybody before the police were called on me.
Gosh.
That's what I'm telling you. That's the situation I'm trying to deal with. Is I have a criminal trespass court date coming, which includes me being, could lead to fines and jail. And I went in asking for a HIPAA care specialist above Kathy Broom because Kathy Broom had thrown me out before. And so I am trying to deal with this situation since then. And so
So basically, you were just trying to get help on a bill.
yes, I was trying to correct my HIPAA information. Yes, ma'am. I was trying to contest that,
Right.
that I'm uncooperative because I'm not uncooperative. My bills are paid through
Right.
Medicaid. If y'all billed Medicaid, they have 45 days to pay. If they hadn't paid and the 45 days aren't up, why are you automatically sending me the bill? What happens if my community members go ahead and pay that bill? Are they automatically reimbursed? If so, after how long? How are they disclosed of that information? How do they find out that information was disclosed?
Right.
That's what I'm trying to. That's the issue I'm dealing with today. Not just the billing
Right.
issue. Is I have a criminal
Right.
criminal trial coming up for trying to fix this issue at the hospital level.
So, I'm just trying to think here.
And at that deal, you can see me clearly on the tape showing the security guard a scannable. It's scannable to y'all's system. Came straight out of the ER. Open paperwork where I'm telling him I'm here to talk with a HIPAA specialist about this violation. It's on video. It's on. The police have it on their chest worn cams, I believe. That I'm there going. I'm here to speak with a HIPAA specialist regarding this information and contesting my paperwork. And I was given a criminal trespass date and escorted out by the police. And that is the issue I'm dealing with today that has to be handled today. And the reason I called Mr. Cam is not because I want to involve him, I'm not trying to entrap anybody. I'm trying to say he stood up in the past and was a man of his word. And
right. Absolutely.
And I'm looking for him to do that same thing here.
Right. And see, I think maybe he missed because when he called me, he said, "Can you make sure that his bills are all all his bills got paid?" Which, when you sent me this one, I could clearly tell that it had not been sent to Medicaid or taken care of.
Right, and you can see where the failed process is. I mean, whenever I showed it to Randy, he saw exactly where the failed system was. He was like, "This is a process failure. I can fix it, and it'll be addressed." And then it happened again. And so I thought updating him on the issue personally would be the way to go.
Right, right. So, oh man, I'm trying to think.
Because I don't want to go to jail, and I don't want to starve to death trying to protest to get the hospital to do the right thing. It's just your guys happens to be the side that I don't get thrown out of. I mean.
Right. I completely get it. I'm trying to think. Let me. Have you talked to anybody in St. Louis, maybe at the level of their risk management or
they will not talk to me, ma'am. They will
anything
not.
like that?
You can follow this whole thing on no NDASSM. They will not talk to me. They will not talk to me. They refuse to handle it. I mean, it's all documented. It's all the videos, the live calls. Ours is recorded here. It's all recorded. It's all videoed. They're refusing to handle this situation, and then have met me twice with police. Once to get me criminally trespassed. I have a pending trial date, or not trial date. I have to go to court. Yes, ma'am. I was threatened with arrest. It was if I didn't leave, the police were going to escort me, or were going to arrest me and take me out in handcuffs. And that's verifiable. I mean, that's 100%. Shawnee Police Department will verify it. There was a sergeant there, there was a corporal there, and I don't know the rank of the other gentleman.
Okay.
And I'm not trying to pass it off on the police. They were just doing what I'm there asking for certain information. The local police don't generally work with CFRs and things like that.
I mean, I'm just going to take. I feel like your complaint is you just want some answers.
Yes, ma'am. That's exactly it.
No, I mean,
that's it.
The bottom line is you want answers.
I want answers and an apology.
You're not getting those answers.
I want an answer and an apology, and I want that administrator that had me removed held accountable. Those were my only three demands. Those are my only three demands and have been since July.
Okay. Let me reach out to a local risk manager here and see if she can give me direction on maybe something that she could help with. right
No,
now.
take your time, ma'am. Like I said, I'm not here to try and entrap you. I'm not here to try and. I'm not. This is not a got you. This is not a got you. Your
Yeah,
company's.
no, I completely understand. Let me make a couple of phone calls.
Okay. Okay.
And then if you did write down all this information, so we need to make sure that this bill gets paid.
Okay.
And then let me make a couple of phone calls and see if we can get you somebody to talk to that maybe can help and lead you in what you need to do.
Okay. I've been dealing with Nikki Hangel's been at the Oklahoma City office. Is who they've been directing me through, and I'm not getting anywhere. I mean, she's limited in what they'll allow her to do. She doesn't have the ability to force me to do that.
Do you know how to spell her last name?
Yes, ma'am. It is
Okay.
HANGSLEBEN, I believe. And like I said, on that no NDA at SSM, it covers, I mean, my paperwork's all laid out there, my accusations are all laid out there and verified. Everything is laid out there and available. I mean, I haven't hidden anything that I'm not willing to make public to you guys, but it's going to be in a public setting.
Right.
Because I got arrested, or dang near got arrested. I was, criminally charged and definitely detained. The last time I was there asking for a HIPAA care specialist. And that's an exact quote. I mean, it's on film. The officers will verify it.
So the reason, I mean, I guess I'm not understanding the reason they wouldn't talk to you and let you. I guess I'm just not kind of understanding their process, which I don't.
No, there's no logic to it, ma'am. Don't try and make logic out of it because there is none to it.
I guess I'm not understanding because I mean I take care of patients every day that have questions.
Mm-hmm.
I try to answer those questions appropriately and make sure that they're taken care of.
Yes, ma'am. You've been great.
I'm having a kind of a hard time understanding why they wouldn't just help you with what you needed.
Yes, ma'am. I have a hard time understanding that myself.
And so, did you talk to Kathy Broom, or would she not talk to you?
The way it initially happened is I came in on Friday at 12:30, and Mr. Cam can verify that this information's correct. But I came in on a Friday at around 12:30 p.m. and this was mid-July, 13th, I want to say. And this is off the top of my head, so it may be due to a little bit of inaccuracy here, but around the 13th, and this is all documented on the no NDA, but I came in and I asked to speak with a HIPAA care specialist because they had me down as uncooperative. Well, I'm not uncooperative. When you let somebody is uncooperative, there's potential that it gets transmitted wrong, to a doctor or, you know what I mean? If it's not accurate information that the doctor has, there's potential for harm. And so I wanted my data to be accurate. And so I noticed when Centauri called me that I don't do business with Centauri. I didn't have any. So anyways, I go up there to confront a HIPAA care specialist to challenge update my HIPAA information. At the time, I came in the west side, the y'all side, and the ladies up front, I was treated very great by y'all side. I have zero complaints about the way I was treated on y'all side. But I told them what I was there to do. Now, from that 12:30 point until after 5 o'clock, I was passed around a series of different people. And I'm telling them, I'm here to update this HIPAA information. I have this videotape of me on the phone with Roxanne. Roxanne doesn't know who Centauri is and can't explain to me why they have my information. And so I go up there and they keep sending me the wrong people. Well, I can't answer that. I'm the wrong person. I'm not the one that can change your update or update your info. And so after 5 o'clock, I'm on the phone with Perry from Missouri, and he's telling me, I'm going to send somebody right now. He said, wait at this entrance, and I will send somebody out. And I said, okay. At the same time, the Oklahoma City office, and this is verifiable from y'all's front-end ladies there, told me that I will have somebody there within 15 minutes, or, 15 to 20 minutes to meet with you to fix this issue. Kathy Broom walks in the room. She listens. She said, what can I do for you? I said, I need to challenge my HIPAA information. I said, this is the phone call I got. And now, here's the thing. She instantly shows up with security. Instantly. And at no point was I a threat to anybody. I was asking for a HIPAA care specialist to update my HIPAA. So she shows up. She said, what can I do for you? I said, I need to update my information. I play her the Roxanne video, which you can go back and watch. And I said, I need clarification on what that threat implies. And she said, that's not a threat. You need to leave. And I said, ma'am, if it's not a threat, can you explain to me what policy it is so that I can know what, at least who the hell Centauri is and why they have my information? She said, I'm not going to tell you again. You need to leave. And the security guard, and I said, ma'am, I want to challenge the information. And the security guard said, that's not a threat. You need to leave. And I said, first of all, Harold, the security guard, your job's not to weigh in on my HIPAA information. Your job's to secure me or the perimeter. You know, it's not to weigh in on whether or not I can challenge my HIPAA information. You're a security guard. And I said, now I'd like to update this information. She goes, I'm not signing my name to anything. You need to leave. And I said, are you asking me or telling me? Because state statute 7620 says it's illegal to remove me if I'm asking for you. She said, get him out of here. And Harold said, I'm telling you to leave. And so I left without problem. I came back the following Tuesday. I said, I need to speak with a HIPAA care specialist above Kathy Broom regarding this HIPAA violation because I'm making a complaint on Kathy Broom about this deal. Kathy Broom walks into the room, turns to me and goes, you need to leave. And I said, are you asking or telling? I said, if you're telling, then it's going to involve the police. And so anyways, long story short, the police show up and they're like, look, dude, they're not going to print the shit off. Just leave. You know, it's that or they're going to make me arrest you. And I was like, all right, fine. So then this new bill comes. Within 2 days of getting it, I show up at the hospital during business hours. I go to check in at the screener. I check in at the screener. And as I'm washing my hands, he picks it up and calls security. And Harold, the security guard, shows up from around the corner and instantly goes, do I need to involve the police? And I said, yeah, Harold, at this point you do. And so he did and had me criminally trespassed. And this was last week.
Okay. Let me call one of our, she's kind of like call the risk manager, and let me see if I can't get you some help.
Thank you, ma'am.
Let me see what I can do.
Okay, yeah.
And maybe she can give you some direction on what you need, because I don't feel like you're asking too much. I think that if you just wanted some questions answered, and maybe they didn't deliver that.
I just wanted some disclosure.
Give me just a little bit. Let me see what I can do, Mr. McLean.
Thank you, ma'am.
I will get back to you. Maybe just a little bit, because I've got to go down, and urgent care is having some issues, so I got to go down and check on them.
I understand.
And then I will call you back.
All
okay?
right. Thank you, ma'am.
You're welcome. Bye-bye.
Bye-bye. I don't know how much of that actually got translated, but it sounds like they got an understanding of the issue. So here's hoping.